So good evening. Anyway, I'm Dr. Albert Mensah, and welcome to our, usually call them fireside chat, but for today's purposes, I guess our little mini seminar. Tonight I'm going to be discussing a topic that I feel is extremely important because there's so much misinformation about things, and revolving around diet. But this is not about diet, it's about diet and mental health, which is a very different topic. Okay? Most of us have heard for years controversy, discussions about what's the best diet for your body and what's the best diet for this and the best diet for that. We've gone from paleo and caveman to Atkins to casein-free to a variety of things. And throughout all that time, I've heard from multiple sources. Many patients come to us and we've tried this diet and this diet and this. What's the best diet? Well, finally, I got tired of it when members of my own family started coming to me and saying, well, I'm doing this, and I'm going, what do you mean you're doing that? You haven't tested this, you don't know this, you don't know that, so what are you going to do? And they're saying, well, as far as I know, I'm okay. So, okay, very well. So now I think it's time to go more public with this concept. So tonight, our focus is going to be on pretty much diet and mental health. So don't throw anything at me because I may say some things that you don't agree with, but I want you to be cued into the fact we're not talking about diet for individuals who are just getting on quite happily in life. We're focusing on very particular individuals and not the entire spectrum of the population. Okay? So let's orient our minds to that particular point. Now, for tonight's discussion, I want us to focus on one particular element. We talk about biochemistry, and we talk about nutrient imbalances. And we basically test patients for nutrient imbalances, and then we create nutrient therapeutic programs to treat them. This is in general, whether it's autism or Alzheimer's or ADHD or depression or bipolarity, any of those things. What we've noticed is that there are biochemical imbalances that are associated with the symptoms that people use to create these diagnoses. So what we look at is the treatment of those biochemical imbalances, correcting them, and then seeing what's left over. And many times we get a great deal of resolution. So now, when we're talking about these, one of the most important imbalances that we talk about involves this particular molecule, which is a very simple molecule. It's a carbon with 3 or 4 hydrogens on it. And we reference that as a methyl group. Just write methyl up here. I never understood in my days in college, and even in my early days of med school, the significance of this particular thing, except that it caused me a great deal of angst because most molecules on the planet seem to revolve around methyl somehow. And we were told back in those days in general chemistry at 8 o'clock in the morning that methyl groups are just there to they modify things, and that's all they ever told us. Well, then we found out much later that methyl groups are extremely key in our everyday existence. Methyl groups, in fact, I said the word key, that's a good one, key. Methyl groups are the keys to many activities, not only in the human body, but in the human brain as well. They're the keys to activation or inactivation of enzymes, hormones, and neurotransmitters, or NT for short. Okay. So if you don't have enough of these biological keys, there's a problem. And we call that, I'll just put it over here, load equal under methylation. Okay. Well, where there's an under, there's usually an over. So on the other side, if you have too many of these methyl groups, you are over-methylated. Well, now I'm sure some of you are sitting, okay, Dr. Mensah, get down with it. I don't want to talk about these particular diets and so forth and so forth. What's so important about being under or over-methylated? Well, let's start with personality types. Many individuals who are under-methylated have very interesting personalities. They tend to be driven by perfectionism. So imagine starting around age 2 and you finally get to see your toddler walk and they're kind of doing the thing that they do and they're very careful about it. Well, maybe that's a little bit sign that they want to get things perfect. then they turn out to be little academic geniuses, and they do well, and they go through high school and college getting A's, and they're driven, and everything is about control and perfectionism. Well, you know what? That's often very closely associated with under-methylation. I call it the D syndrome. Most of our Ds in the world are actually under-methylated individuals. Our PhDs, our MDs, our JDs, our educational Ds are often very times under-methylated. Know any of those folks? Perfectionistic types, educators? Can't tell them much, can you? It's like, well, you know, I studied for 25,000 years on this topic, and by golly, no one's going to tell me any differently. And then, of course, where there's the under-methylated, there's the over-methylated. Now, these folks are rather different. These are more your relaxed, philosophical guys, your very philosophically entangled individuals who must ruminate and philosophize about everything. There are philosophers, our artists, our poets, our musicians. These are the folks who add a lot of color to our lives. They require a muse. They require finding that inspiration before they run off into the woods and create a sculpture, and they spend 10 days without eating and they're unbathed, and they finally present the piece of art, and it goes on sale for about $20,000. Or our great musicians who create these masterful pieces, whether it's Beethoven or Led Zeppelin, whoever your preference. Okay. These very creative individuals are oftentimes over-methylated in terms of personality. Now, these over-methylated individuals, on the other hand, although they appear calm and cool and collected, your smooth jazz, easily listening kind of folks, they have a great deal of inner tension. Okay? A great deal of inner tension and anxiety. They can ruminate a lot. Now, after a certain point, in terms of what we call normal regions of under-methylation and over-methylation, there can develop a great number of problems. Problems such as anxiety or depression. And being either under-methylated or over-methylated can actually create anxiety or depression in the extremes. So you can't just tell by saying someone's anxious whether they're over or under-methylated. But many syndromes like autism, ADHD, Alzheimer's disease, in addition to OCD-type behaviors and anorexia, are oftentimes associated with, under-methylation. My board is a little bit flipped here. I usually write over here and under there. So over-methylation, on the other hand, many of these individuals are highly prone to reacting poorly to SSRI medications or the serotonin-specific reuptake inhibitors. They tend to have an effect on the methyl such that it makes them highly sensitive, and they can become suicidal or homicidal in nature. So there are some ramifications to the extremes of these particular chemistries. So now that you've all been infused with this important piece of knowledge, let's turn to the concept of diet and why I consider that so important. One of the major arenas that we talk about with regard to diet, and everyone has heard of this, has anyone here not heard of vegetarians? Okay, has anyone not heard of carnivores? Okay, well, nobody's saying anything, so we've all understood that, we've all heard about them. Well, which is the better diet? The most logical answer I've heard in quiet. She said, it depends on who you are. And that's absolutely correct. But the next point I want to bring up is that there's a difference between here and below and here and above. What is good for the body is not necessarily good for the mind. Let me say that again. What is good for the body is not necessarily what is good for the mind when it comes to nutrient therapy and treatment for behavior disorders or thought disorders. Okay? This is a very, very hard concept for individuals who are nutritional therapists in Ireland to understand when we were over there talking to them and doing seminars. I heard one lady say to me, you know what, Dr. Mensah, give us a little bit of time here because we were taught that what's good for the body is good for the mind. And so all of our protocols were based upon this, so it's a little bit daunting for us to kind of to move into this direction. Well, I said, I hear you, but we only got 3 days to talk about this, so let's get this understood quickly. Okay. There's a difference between treating someone for physical health and treating someone for cognitive health. And this basically is only relative to individuals who are already having cognitive problems or challenges. This is not about the average Joe going about life happily. In the morning, go to work, irritable at the boss, come home, you're tired, you rest, you relax, you have fun with your family. Life goes on. It's not for those folks. We're talking about individuals with behavioral disorders, individuals with autism, individuals with ADHD, individuals with anxiety, depression, bipolar, schizophrenia, any of those things. Why? Well, one of the reasons is here. Methyl groups can be affected by our diet. Okay? Now, methyl is just one element that we talk about. Let's also talk about copper. Copper is another very interesting element. Called Cu for short. Okay? Copper in and of itself is not a huge problem. But when we add too much copper to a given system, it can affect our neurotransmitter pathways quite tremendously. Copper will force the conversion of dopamine into norepinephrine, our fight or flight neurotransmitter. So imagine that heart pumping. I know it's hard to believe, but in Chicagoland, being chased by a bear, that's a hard thing, right? But nonetheless, strange things happen. Let's use wolves or coyotes. You know there have been coyotes sighted in downtown Chicago in the dark? Can you imagine you're on Rush Street and all of a sudden a coyote comes up to you? Your heart's going to be pumping like this. Well, that's norepinephrine doing its little thing on what we call the beta-1 receptors of the heart. Okay? Now, too much copper in the system, on the other hand, can pretty much force dopamine's conversion to norepinephrine far more consistently than you would like. So you end up with sort of this ongoing hyperexcitation thing that tends to lead towards anxiety and then can produce depression. Okay? So copper is one of those elements we have to be careful of. In women, too much copper can also cause postpartum depression or depression period. Or actually, too much copper in the system can lead to the development of fibroid tumors, irregular bleeding, and a variety of other issues that unfortunately make a woman's life very difficult in the medical community. So copper has major effects in the system as well that can be very negative, not just on a physical but also a cognitive level. So copper is something I want you to keep in mind. So let's recap. Methylation status, very important. Copper levels, also very important. Okay? Now then, I'm going to stop right there because those are two heavy imbalances, you just don't know it yet. Excess copper, by the way, can also cause a great deal of fatigue. And the reason is because it hits a biochemical pathway called glycolysis. Glycolysis is a pathway that's designed to produce energy. It actually leads to the TCA cycle, get to another cycle, ultimately resulting in these little energy packets we call ATP, or adenosine triphosphate, for all you biochemistry buffs out there. Now, what happens with copper is that it stops 3 different enzymes in that first pathway from functioning, or functioning very well. And so you end up with fatigue. And many individuals have heard of chronic fatigue syndrome, fibromyalgia. All those things have copper toxicity as a component, potentially. Okay. So we also need to be careful about copper. All right, I think that's enough biochemistry for now. Now let's talk about this whole idea of vegetarianism and veganism and carnivorism. Now, quite frankly, I honestly don't care what you do with your diet. That's a hard thing. Why am I up here talking about it? Okay. Well, if there's a I don't like that term mental health, we're so used to saying it. If there's a cognitive challenge involved, now I care. Okay. Because we're so predisposed by many communities in the nutrition world to believe that certain diets are better than others, blanketly. And that's simply not correct. How do you know what's good for you versus what's good for him, what's good for me? Unless we look inside our innards. We've got to take a look at our chemistry to really be able to say, well, you know what? As a person with a cognitive imbalance or cognitive health issue, I might be susceptible to these factors, and so this might not be the best diet for me. Okay? Well, let's just get specific, all right? Let's go back to this concept of methylation. Let's talk about something very simple, depression. I only say it's simple because it's just one word as opposed to something, something, something disorder, okay? But somebody who's depressed and who's on medication or seeking help for the depression because it's a lifelong depression, or it's a postpartum depression, or it's a depression that's not simply rooted in some circumstance that came and went. Okay. Now we've got to ask the question, this form of depression is probably rooted in some type of biochemical imbalance. So we test for that biochemical imbalance, and let's say we find out that that depression involves undermethylation. Okay. So we create a nutrient therapeutic program, which is what we do here at Mensah Medical, and we formulate all these wonderful nutrient supplements for you to take and compound it, and you start taking them and you're feeling good, but then we find out later you're not doing quite as well as we should be doing. So then we ask, well, what is your diet? And you say, well, you know what? I eat a lot of dark green leafy vegetables, and I pretty much just kind of stay away from these things. I eat a lot of soy. I say, you know, there may be a problem here, because all those elements that you just mentioned are very high in folates. Okay? Now then, so wait a minute. I thought folic acid was good for you. I said, well, we all need folates. That's entirely true. The only difficulty is that folic acid, when it comes to mental health challenges or cognitive imbalances, can be very detrimental to people who are under-methylated. I'm going to show you why. Taking you back to high school biology, and let's talk about the human cell. Okay? Big circle. And then the nucleus of the cell. And this is an area we call the cytoplasm. This is where all the little rugrats in the town run around biochemically doing whatever they do out here. And here's where we keep our DNA. Remember I mentioned earlier that methyl groups are designed to actually activate or inactivate enzymes, hormones, and neurotransmitters? Remember we talked about that? Well, methyl groups also affect DNA. They allow for genetic expression to occur appropriately. There's actually a balance between methyl and other groups, but we'll just talk about methyl for now. Now, folic acid has a very interesting effect on the cell. Many practitioners around the world actually believe that folic acid is a great donor of methyl groups. And it is, but it all depends on what location you're talking about of the cell. Here, outside of the nucleus, folic acid greatly donates methyl. The only problem is that the nucleus of the cell is different from the cytoplasm of the cell. In the nucleus, folic acid is an Indian giver. It says, give me back my methyl. So it takes away methyl groups from the very area that you need in order for your DNA and its wishes to be expressed. So if we take a blueprint, as we say, DNA is the blueprint of life, and we strip it of methyl, all of a sudden, the DNA starts to see shifts in areas of programming that are supposed to be nicely packaged in a very particular array. Excess folic acid causes a change in what we call genetic markers, a shift, if you will, so that all the messages that are leaving the DNA are now sort of shifted or moved into a different place. So maybe, for example, the particular protein that's supposed to be made from the DNA is supposed to allow you to be a powerful person, able to tolerate all types of stresses until you get to upper middle management at age 60. So instead of that happening, fresh out of high school, you can't cope and you don't go to college. Now that's an extreme example, but I'm sharing with you sort of a domino effect that changing the methyl status in the DNA can have lifelong in terms of the effects. Now that is real, because we know individuals who are undermethylated, for example, can possibly become alcoholics or anorexics or a variety of other things. That's a huge lifelong domino effect, starting from the DNA and its methylation status. Okay? So I think you kind of understand how important it is for methylation to occur in its appropriate ways at the appropriate times. It's not just methyl, though, it's methyl plus the environment. This is what we call the field of epigenetics. We're looking at what the environment, literally in the womb, between days 16 and 21, does to a person's methylation and demethylation, for all lack of better terminology, and how that person develops as a result of that. Okay? But now back to our cognitive health challenges. Let's say you're a person, once again, who has depression, but you firmly believe that having a diet that's rich in vegetables is good for you. So you chow down. Every day it's the same old thing. You get on your bike, you exercise, you do everything that you believe you're supposed to do that's supposedly healthy. But did you feel depressed? You may be able to carry on throughout the day, but at nighttime, you cry yourself to sleep. You don't understand why you're miserable. You've checked your circumstances. Everything seems to be going well. That guy you call your male friend or lady friend or whomever is okay, the family's doing okay, but you just don't feel good and you don't understand why. Okay. Well, you may not know your methylation status, and I'm not saying this is the cause of your problem, but what I'm suggesting is that it could be exacerbating your condition. Okay? You might be an undermethylated individual who's taking on more folates in their diet than they really need to, and hence you're actually taking away more and more methyl. Now, whether you ate the folate-rich foods or if you ate, methionine-rich foods, you'd still be an undermethylator and be prone. But in this case, the diet is actually exacerbating what it is that's already there. Okay? Well, Dr. Mensah, that's all nice and dandy, but how do we know you know what the heck you're talking about? Well, you know what? How about empiric evidence? Okay. Seen many a patient come in with certain diets. We check their chemistries. We know that they are one way or the other, and then boom, you know what? They continue with the diets and they get worse, even though we're treating them. And we know they're treating them correctly. We've seen a lot of patients over time. Okay. But they're not doing better. Or they're doing better, but they're not doing as well as they could. And we find out, well, you know what? Your diet has just been a little bit shifted to the left there, and we need to kind of bring it back to center. Now then, let's talk about the other side. The overmethylated individuals. Well, guess what they should be eating? Foods rich in folic acid. That's right. Eat like a bunny rabbit. Knock your heart out, okay? Enjoy. Those foods are extremely beneficial for them. But you want to know the real interesting irony? I've been thinking about this now for about 3 or 4 months. About personality types, cognitive disorders, and diet. Do you know who really seems to care more about dietary status and what they're eating? I saw someone smile. Take a wild guess. Absolutely. The more OCD, the more undermethylated individuals. And they're so excited about eating properly and doing the right thing. What are they tending more towards? More towards vegetables. And they're doing everything they can think of. In fact, they start to even accelerate that process. Say, well, I'm doing everything, but I don't have the kind of results I'm looking for, so gosh, I'm just going to go cold turkey. I'm just going to jump into being a vegan. And then they start doing worse, and they're doing worse, and they can't figure out what the heck is going on. Well, we have a slight clue there. Now then, on the other side, we've got the good old carnivore sitting back there chowing down on a pterodactyl burger, this big, eating a steak, saying, boy, I just don't feel too well, but I love my steak. It pleases my tongue, but it just destroys my brain. Afterwards, I'm in this fog, I'm in this funk for I don't know how long, and this doesn't, but I'm not going to stop because I love the stuff. And then, of course, there are the other physical factors, we won't get into that, but for that person, quite often you would suggest, well, you know, you might try more vegetables. in your diet. And they say, oh, great Scott, vegetables? Those things are poison. It was on the Simpsons episode, Homer nearly died from cauliflower exposure. He says, well, we're going to have to modulate a bit of that. So now, some people say, well, what about a normal, healthy, balanced diet? Well, in terms of mental health challenges, if you don't know your biochemical status, it's probably a good idea to kind of stay neutral. Eat your vegetables, eat other things, keep it balanced, and you don't tend to go wrong in that capacity. But it doesn't necessarily mean that you're maximizing your capacity with your diet for your chemistry. And this is all starting to sound so confusing. First you're saying don't eat this, don't eat that. Now you're saying be in the middle here, but now you're saying but you could do better one way or the other. Well, here's the first point. How about if you've got those challenges, get tested. Why not just find out what your chemistry is? One simple test for methylation. And in this case, we're just talking about a regular old histamine test. So now what I'm telling a lot of people, I'm telling a lot of patients is this. Listen, you're going to ask me about diet because you do anyway. Patient walks in, sits down, we're talking about 15 minutes before what about diet? What should I be eating? So, Mrs. So-and-so or Mr. So-and-so, first let's test you. Then we can talk about the types of diets you should have in your system. Okay? So a simple test can tell you, if you're an undermethylator, be careful. I'm not saying don't eat these foods. I'm not even saying don't enjoy these foods. I'm simply sharing with you, you don't want to be an extremist with regard to these particular foods because they can have the opposite cognitive effect of what it is you're trying to do to your body. And here's the interesting thing. Back to our original assertion that what's different here or what's good for this is not necessarily good for that. Here we see something where all those wonderful green leafy vegetables are great for the colon. They clean you out. They keep you feeling good. Many people are regular. We know how regularity is a great thing for many people. Some people are not happy if they're not regular. I'm not going to get too much into that. But the point being, feeling good here, but at the same time, still feeling troubled here. There's no balance there. That's because there's a big disconnect from here down versus here up. And we need to look at, well, now, how do we create a balanced mind-body relationship? Okay. And that can be a little bit challenging, but it's not that really difficult to do. And on the other side, the question is, well, okay, do I really need to be a carnivore? Maybe I need to enlighten myself a little bit on the other side. Okay. So if you're an over-methylated individual, then perhaps we need to consider eat more nice dark green leafy vegetables. Okay. Had a couple of family members recently talking to me, and I heard this expression and said, well, gosh, I've been tested and I'm an undermethylator, but I just went vegan. And I said, oh, that's a bit of a problem. I said, well, now you're undermethylated, but are you actually having cognitive issues? Yes, I'm very depressed. I cry myself every night to sleep. This happens, that happens, that happens. And I look and I say, well, you know what? Let's make an informed decision. So I'm not going to tell you what to do, because the odds are you're not going to listen to me anyway, because you're a family member. And I'm just that guy from when we were growing up. Okay? But here's the data. Here's your test results. Here's everything you need to know. You're an undermethylator. I've Googled for you foods rich in folic acid. You decided you want to be vegan. Now all you have to do is play hopscotch through all the foods that are rich in folic acid, and then you can kind of make sure you don't eat too much of certain areas of food and you can get a little bit more of some other areas. And then I just kind of leave it at that. Okay. Don't want to argue, don't want to fight. Not going to get into that. But the idea is information. Information allows you to make an appropriate decision for you. And that's what we want to do. We want to help empower you to better know thyself. Only you know how you feel 24 hours a day. Well, maybe you don't know when you're sleeping, but you have an idea when you wake up. Okay? So certainly we want to make sure we have a real idea or understanding as to whether or not some foods really may not be beneficial for us. On the one hand, good for one part of the body. On the other hand, bad for one part of the mind. or at least part of the mind. Now, let's leave the whole vegetarian carnivore debate thing alone. Let's move on to other areas and other topics. People often talk about now casein and gluten-free diets. Anybody not heard of a casein-free or gluten-free diet? No, our audience says we've all heard of it. We've got a very quiet audience today. But certainly, many people are trying these diets when they really don't have any sensitivities as far as they know. Okay. Now, why do I bring this up? Because it's not an easy diet to go through. Not at all, especially if you've got family members and you're trying to be casein-free, gluten-free for you, or maybe you do have a child or a family member who's got these challenges, whether it's an inflamed bowel or whether it's severe allergies or sensitivity, or maybe it's just even clouded thinking and judgment when you have these particular disorders. And you're trying to cook properly for them, but everyone else is just having a hard time because they're eating normally, or at least trying to. But your time and your energies are divided. Well, there's a difference between sensitivity and allergy, okay? And many people don't understand that. One can be sensitive, but not allergic. Let's just say sensitivity is a light reaction and allergy is a severe reaction, just for didactic purposes, okay? Now, if you are sensitive to some foods, it has to depend on what that sensitivity really means to you. Does sensitivity mean you kind of walk around with your head kind of cloudy, or does sensitivity mean you break out in a rash? So might that sensitivity really be an allergy? Sometimes it's very helpful if there's a doubt in your mind to get an allergy test done. Allotest and other companies provide these testings of IgG and IgE antibiotics for anywhere between 90 to 150 different elements. Very easy to find out if you are indeed allergic or sensitive. Why bother go through that testing? And mind you, I don't own stock in any of these tests, by the way, I'm just letting you know. But what I'm sharing with you is that the importance of these tests can tremendously ease your home life and your outdoor life, for that matter. When you go to restaurants, you're struggling to find foods that are gluten-free. A lot of restaurants are doing better. A lot of restaurants throughout the country are now serving gluten-free foods. But the difficulty is that, not everything is. And the question is, do you really need it? Now, with our kids who have Asperger's or autism or developmental delay or different conditions like those things, about 60 to 65% of these kids really should have a good trial of a casein-free, gluten-free diet. It's that kind of important because if they are sensitive or allergic, their responses are tremendously greater to those elements than what somebody who doesn't have any of those challenges would respond to. Okay? So it's kind of like the pebble versus the boulder. Their level of sensitivity and reactivity is that huge boulder, whereas for us it just might be a little tiny pebble of irritation. Okay? So you have to keep those sorts of things in mind. I want to pause here because I want to ask if anyone has any questions.
Can you tell from an allergy test, black and white, you need casein-free, gluten-free or not? I mean, is it that simple?
There are many elements that can suggest to you it would be a good idea for a trial. Now, there are tests that just say, yes, you are sensitive to casein, and yes, you're allergic to gluten. Okay, but when it's equivocal, that's when the gray area comes in, and it's a little bit harder to define. But absolutely, there are tests. Now, the way we kind of look at that is there are two ways to approach those types of diets. Now, one, you can get the testing done, or two, you can just go through it and try eliminating any of those foodstuffs from your diet and see how you respond. Okay? Some people try it that way. They spend a year. The first 6 months, they're going casein-free. The next 6 months, they're going gluten-free. And after a year, they say, it made no difference whatsoever, except to my pocketbook and all the gray hairs I came up with from trying to find all the ingredients and keep things out of the pool and keeping this one separate for this kid and this one. And I've got 5 kids and blah, 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 blah. That's a whole nother story. But yes, there are tests that can very easily sort of determine those things for you. It's just a matter of cost.
It's easier just to spend the money and
Sometimes that's the easier way.
right? I mean,
Sometimes
that's
that's
a
the
nightmare
easier
trying
way.
to do a casein-free, gluten-free diet.
It is extremely hard. It's extremely hard to do that diet. Other diets that were around, One very interesting diet was the Feingold Diet. Did you ever hear of the Feingold Diet? No? We have some yeses and no. Actually, it's a very good diet. The idea here is removal of salicylates and removal of petroleum-based elements, things that are in dyes and colors in plastics and so forth. Very, very difficult to do. But here's the deal. The question was, really, was it a good diet or a bad diet? Because I still see people coming into the office who say that they tried the Feingold diet and they had some good results. Some say they had some equivocal results. Well, Dr. Feingold actually came up with a very, very good dietary construct, which was that people may be sensitive not so much to to a gross element like an apple or a pear, but perhaps something that was involved in the processing or something that's innate like salicylates. So moving very sequentially from one elimination to another, he developed a sequence by which someone could determine if they were doing better when not exposed to these things versus when they were taking them. The problem that came in with regard to the reputation of the Feingold diet was when they actually created the full-blown study to do this. Unfortunately, it wasn't Dr. Feingold's fault, by the way, but some of the creators of this study actually did this rather inappropriately. They got bad results, so the diet actually got sort of a bad reputation. But in all actuality, the Feingold diet was actually a very, very good diet, and many people still doing that one, are having a pretty grand time with it. More recently, people have talked about the Paleo Diet. Now that was interesting. I was on a plane one day traveling from here to California or someplace, and I was reading about this fellow. He said, by golly, I spent the last 20 years in the Andes Mountains. There I was with the natives. I saw 70-year-old men and women with the bodies of 30-year-olds. They were buff. They were without fat. They were carrying big giant sacks up mountain tops and reading on and on and on and on and on about this. And he said, well, their diet was very interesting. And the way he sort of paraphrased it was, well, if you could pick it off a tree, if you could pick it up, and if you didn't have to do too much processing after you slaughtered it, you could eat it. And I kind of paused and I thought about that. And I said, this is sort of that whole Adam and Eve diet kind of thing. What is he really talking about? He's talking about a decrease in processed foods, a decrease in white flour and all those fun sort of things. And we've seen similar diets before. They just kind of cycle through with different names and different ideas. And once again, for individuals who have cognitive disorders, that can be a very, very important piece. Now, for individuals who have bowel disorders, let me confuse the issue even more. Because there is a connection between the bowel and the brain, okay? But treatment tends to be a little bit kind of fuzzy here. Now, let's talk about this. Individuals who have inflammatory bowel disorders, Crohn's disease, ulcerative colitis, many of the other colitis, as we call them, leaky gut syndromes, anything that they eat may not get broken down properly. Now, that has two consequences. Firstly, the lack of breakdown means you can't break down the foodstuffs into their appropriate amino acids. You can't break down foodstuffs into appropriate amino acids, you can't make your enzymes, hormones, and neurotransmitters very well. If you can't make those things very well, how do you process in your brain anything? Because your brain communicates, all the nerve cells in your brain communicate by nerves and chemistries and neurotransmitters and electricity. So if you hotwire the electricity with a little bit of copper, you get a little bit of a spark there and you get miscommunication, which later on tends to lead to anxiety or some other syndrome. But if you can't make your neurotransmitters, not only might you not feel good, but you might have erratic responses to very normal stimuli. A simple hello from somebody, just kind of stare at them like, what does that mean? Or a simple, get out of my way, and you go, hi buddy, how are you doing? Inappropriate responses. Very, very simplified, in fact, overly simplified. But the idea here is that if you have a gut disorder, that can actually translate into a cognitive issue from a neurotransmitter basis, from a protein production basis, and from an enzymatic activity basis. Part 2 of that, inflammation. If your bowel can't absorb it, you've got a leaky gut issue, that can lead to inflammation. Now that inflammation doesn't just stay in the bowel. it actually can transmit to the brain and create sort of a brain fog, or even sometimes depression. It can create a great deal of pain, which often leads to anxiety, which also can lead to depression. So taking care of your gut is important, and we have to make sure that things like leaky gut syndromes, inflammatory bowel disorders are not exacerbated if we can't heal them right at the moment. Okay? So there are connections between the brain and the body, but still we can't talk about generalizable diets for both. We have to talk about actually treating and healing the gut, in addition to treating and healing the mind. Okay? So now, I think I've kind of gotten most of the bullet points out there that I want you to remember. First and foremost, we're different up here than we are here, as far as mental health conditions are concerned. Okay? Kind of know now, it's important not to assume that there's one diet that fits all. Now, you've heard many people say that, but I'm saying this for different reasons now. We know that the two major categories of person out there, the undermethylated and the overmethylated, can respond very differently to the same diet. So don't sit there. I know somebody's doing it. All your friends are doing one thing. They're either all steak hounds or they're all vegivores, and by golly, you should be one too, because all the latest research is showing that this diet is better for you than that diet, and so forth and so forth. Don't you believe it? Find out what is best for you. You are the only you that's out there. You're the one who has to deal with the ramifications of what you eat, of what you drink, of what you do. Okay? And no one wants to lead a life of depression or anxiety or poor focus or challenges or brain fog, let alone bowel issues. Who needs that? Okay? There are people who are philosophically prone to eat one way or another. Okay? And it's great if you've got a firm belief about something and you just don't want to do certain things because it just annoys you or makes you irritable. But you know what? If you're having cognitive health challenges, find out first what your body needs and your brain needs, and make sure the two are commensurate with what your philosophical ideals are. I remember one young lady came to me, and we were sitting down talking, and all of her symptoms seemed to be that of an undermethylator. And she said to me, what about diet? I said, do you really want to know that right now? She said, well, yes. I said, well, I'm going to wait for your test to come back. But you know, you kind of strike me as a bit of an undermethylator. And I can tell you now, the particular route you're going with the volume of dark green leafy vegetables and so forth, and you're deciding to stay away from meat products. I said, that may not really work well for your mental health. And she said to me, you know what, Dr. Mensah, my challenge with this is philosophical in nature. But let me tell you something. If my mental health is at stake, I will change what it is I do, okay, for the sake of my own health. And I sat back and I said, that's an interesting thing, because that's one of the most honest perspectives anyone can have. Now, on the other side of the issue, what I find really interesting is that sometimes it takes a stroke or a heart attack for some people to realize, you know what, I've been over here doing a little bit too much of this carnivore thing. And now I need to change tracks and do something a little bit healthier. And then there are the very interesting people, I haven't talked about them yet, but I'm going to talk about those who call themselves one thing, what they really are simply non-meat eaters, or maybe they're non-vegetable eaters, but they eat everything else. They'll eat the pastas. They'll eat all the fun, gooey stuff that doesn't bear any one of the other monikers. And they walk around they walk around the middle, wherever it is they go. And I sit back and I look at these folks and I say, now, let me get this straight. You say you eat the way you eat for your health. You say, yes, well, all the studies show that this stuff is over here is bad for you and that stuff over there is not great for you. I said, but this tells me that you, at your particular age, which is older, you're at risk for metabolic syndrome, which means you may be at risk for prediabetes. I said, now, just because you don't eat that doesn't mean all that pasta that's going into your situation here is good for you. Not to mention, many of these other foods that people can overindulge in that fall neither in the vegetable or the meat category can actually create an opioid-like effect that is not positive. Arcasiomorphines, glucomorphines, these are not the positive morphines. These are the ones that shoot you up cognitively, and then you crash later on. Now I'm going to tell myself a true story about Dr. Mensah. I love pizza, ladies and gentlemen. I'll admit it here and now. I am a pizza-holic. However, I recognize one adage, which is that, from my perspective, all foods are drugs. And for me, pizza is a drug that doesn't work too terribly well. I have to plan my time with pizza. I make sure I'm not going to be around any family members. There you go. Amen, brother. I make sure I'm not going to be around any family or friends. I'm going to sequester myself for at least 2 good hours after consuming deep dish Chicago yummy pizza. Okay? Because I become one of the most ornery, miserable creatures you would ever want to see. It's terrible, but I recognize this. And it took me 22 years before I realized that's what was going on. Couldn't figure out why I was depressed, and, just slothy, and people talking to me, and I'm like, get away from me, just leave me alone. Then after a few hours, I'm fine again. Let's be friends. How you doing? Say, no, I don't want to talk to you. Okay. You know how hard it is having relationships like that? Okay. People say, are you bipolar, buddy boy? Well, I had to recognize the fact that the types of foods I was eating were actually having effects on my cognitive functioning. Now, for me, they weren't permanent, but there was something that told me food, for me, is a drug, and it really is for all of us. I know we can all think of foods outside of alcohol, okay, where when we eat them, we just don't feel quite right later on. Now, we're not talking about Thanksgiving and all the wonderful trimmings that come along with the turkey or whatever it is you're eating, okay. That's about overindulgence most of the time. But there are some foods that really just have a very negative effect. And so we have to be careful about that. If it affects behavior, you have to be careful. If it affects cognitive processing, you have to be careful. If you have children who are on the spectrum or have ADHD or have behavior disorders or da-da-da-da-da, you know what? One of their favorite foods, I'm not going to use the first part of the word, but the second part of the word ends in nuggets, okay? Can be one of the most challenging and exacerbating conditions in terms of food utility ever known to man. They dip it in this, they double dip it in that, then they switch to that and add that and add that. And this is a perfect recipe for excitable and hyperexcitable children. Okay. Adults, we just sort of sit back and enjoy it and just laugh because it tastes good for a minute. But we know how to modulate ourselves. A 5-year-old doesn't. In addition, certain foods can produce yeast overgrowth in children. Now, once again, adults can compensate pretty well in terms of behavior, but kids can't. We had one young boy, this is a true story, 5-year-old, kicked out of 4 preschools for behavior disorder. This kid was hitting, biting, scratching, screaming, you name it, this kid was doing it. Okay, 5 preschools later, they came to us. Actually, it's a very simple situation. We found out that he had a yeast overgrowth, severe yeast overgrowth. Yeast not only block, remember we talked about you have to be able to absorb nutrients before you can break them down to make amino acids so that you can make your neurotransmitters. Well, yeast overgrowth can literally coat the gut. And when it does that, depending on the areas that are coated, you can block absorption. So now, long story short, your neurotransmitters aren't being processed properly and behavioral changes occur. Not to mention, yeast also produce toxins. Those toxins can lead to inflammation of the brain, which also distorts one's capacity to grow and process accordingly or appropriately. So in children, foodstuffs can be a really, really big problem. So don't assume that little Jeremy over there, and forgive me anyone out there whose name is Jeremy, kids, I don't know who you are, I'm not saying it's Jeremy. But for any of these kids, that can be a huge problem. Don't assume that they're just mean, evil little creatures, and you look at your spouse or your significant other saying, I want to see the rest of your family. No. It could be something as simple as yeast overgrowth. It could be something simple as dietary reactions or reactivity. I was on the phone the other night with a mother of a 2-year-old, and this poor child just breaks into rashes regardless of what it is that he seems to be taking in or touching or whatever have you. And there's so many cases like that across the world. So hypersensitivities can be manifested by way of behavior or skin condition, or just condition in general. Okay? So don't assume that in the pediatric categories that these are just bad kids. Many of them are functionally malnourished. You know, I come from a country called Ghana, West Africa. That's where I was born. And I know where's the accent. I lost it when I was like 5 or 7 years old. A lot of practice. Anyway, in Ghana and in many poor countries around the world, you know, if you're skinny, you're actually considered poor. Now, if you are a nice, rotund individual, full of girth, looking like you haven't lifted a piece of paper in your life, you're considered prosperous and wealthy. Okay? So to a Ghanaian, for example, fat children are a great idea. Okay, although most of them aren't fat, but nonetheless, the idea is that prosperity is seen in growth. Now, here, one of the things that we would see is that what looks like a prosperous child to a Ghanaian may actually be a malnourished child despite their growth. They're eating the wrong things. They're not getting the right levels of exercise they should be. Those wrong foodstuffs now, when we're talking about malnutrition and you're still portly, we're eating a lot of the fatty foods, but we're not doing what? We're not eating the very vegetables that we need or the right balances of foods. So now there can be behavioral changes as a result of that. I once encountered a 90-pound 3-year-old. That is no exaggeration. I used to teach preschool in another life prior to medicine. And I'll never forget the shock and surprise of this 3-year-old with rolls and rolls and rolls, waddling around. Adorable little fellow, he really was. Sweet as pie. But you know what? His behavior was very erratic. And I believe, looking back, that he was really malnourished from what his mother says was only a high vitamin D or milk intake. And I said, well, he either had a big thyroid problem, looking back on this, or he wasn't eating the right stuff. He was eating the wrong balance of things. And behavior gets to be a problem. Not to mention certain foodstuffs, once again, can predispose to what we call gut dysbiosis, an uneven balance or imbalance of different bacteria or different plants, as you want to call them, that are in the bowel. By the way, I didn't mention, you know, our gut is our secondary source of serotonin. Indeed, primary may be the brain, but secondary, there's a nice big contribution of serotonin that's made in the gut. Okay? So that's something else to consider. With any kind of blockage, any kind of inflammation in the bowel, it can affect our production of serotonin and other elements that can also affect brain processing. Okay? So I think you guys probably all have this at this point in time, so I'm just going to kind of stop here and let's talk about anything that you'd like to talk about, questions and issues and so forth.
How do you know if you have yeast?
How do you know you have yeast? A very, very wise dermatologist once said that skin disorders are often a manifestation of what's going on internally. And it's true. Sometimes with yeast you can see skin irritations, you can see things like eczema or eczema-like reactions. But there's actually a very easy test for yeast. You can do a stool analysis, and you can do an OAT test, organic acid test. Both of those, and urine tests actually. Both of those, all three of those, can tell you if indeed you have yeast or your child has yeast. Very, very simple. Yes, sir.
Could possibly amino acid supplementation possibly mask something that could be going on already, where the body's not able to break down the nutrients properly to create the neurotransmitters? Let's say you're supplemented with amino acids, just separately of that, could that possibly mask something or hide something once you stop the amino acid supplementation that could make something more present?
The question is, does amino acid supplementation, or can amino acid supplementation actually mask a biochemical imbalance? And the answer is yes, it can be. Are you an exercise fanatic?
I am.
Weightlifter? Indeed. How do we know these things? Can't believe it. Been there, done that. Anyway, one of the things that we do know is that we often see these hidden imbalances that are truly masked because somebody is taking a wide spectrum of amino acid complex. Oftentimes, many of those complexes are pretty much, I put it to you this way, void and somewhat useless for what it is you're actually trying to achieve. But they contain maybe 4 amino acids that are powerful and help you get to that goal. But the other thing is that many of the other amino acids that are present are sort of forcing their way through any particular bowel issues, and you're able to make some level of the right enzymes and hormones and neurotransmitters. So you don't see the full effect. But if you weren't taking those amino acids, you might see a much more powerful symptomatology present. See that a lot, unfortunately. I talk to a lot of young men who are out there lifting weights, and it's so funny to see the skinny little teenagers, and they're saying, well, I'm taking, product X, and I go, listen, do you honestly think you're going to turn into Arnold Schwarzenegger back in his prime? And they tell me, well, who's Arnold Schwarzenegger? I said, no. Okay. Big muscle-bound guy, Conan. Oh, Conan! Yeah, dude, he was great. I said, well, no, it's not going to happen. You can't possibly do enough using this particular supplement. So save your money and save your kidneys. Okay, I often tell them that. But in all honesty, we have a very, very severe discussion about what high concentrations of certain amino acids can do. So we make sure that they're pretty well balanced when we have those talks. But you're right, the simple answer is yes, indeed. They can mask those sensitivities. Any other questions at this point?
When
Yes.
you were talking about the different diets and the effect of folic acid versus if you need it or you don't, but you never really talked much about the copper
Oh,
food.
good one. Thank you for reminding me.
And I'll tell you why, because I learned that if you try to do a wheat-free diet, the substitutes are all seeds and nuts and things like that that are high copper.
Amen, sister. Thank you for reminding me. One of my pet peeves, believe it or not, high copper diets. Okay. Why? Because in our drive to get to more appropriate physical health, a lot of the foods that we use as substitutes actually tend to be high in copper. I've known certain households that go nameless, where almond milk, for example, is showing up in huge quantities. And I find it interesting because when I examine these households, what I'm seeing is very moody people. And then I hear in the refrigerator there's almond milk. And I'm not mentioning any companies, so I can't get sued for this. But almonds are high copper foods. Okay? So we're seeing now, as we start to switch in the effort to become healthy and move away from things like normal milk because it's evil, now we're finding out that the substitutes have their own issues. And once again, this is with regard to people who have mental health challenges, whether it's anxiety, depression, whatever. We're not talking about the average Joe, okay? But when we're eating, I hate to say it, avocados, lots of certain dark green leafy vegetables are also rich in copper. Peanuts, nuts. I love peanuts. Many nuts are actually rich in copper. Now, keep in mind, we're not talking about a little dab here and there, okay? Chocolate, yeah, I was going to try to stay away from that, but chocolate, rich in serotonin, lovely amounts of zinc, got copper too. So here's the deal. If you've tested yourself and you know that you are a copper toxic individual, you don't really want to eat large volumes of these other foods because it exacerbates your condition. Notice I'm not saying it causes your condition. I'm saying it can add that edge of worsening for your condition. Okay? Now I want to get very serious about this one because there's more than just that particular piece to it dietarily. We talked about things that copper can affect. We said that we see fibromyalgia, chronic fatigue syndrome. We also see things like endometriosis in females, fibroid tumors, and ultimately cancers. Like, whoa, where did that come from? Now we're going to deviate. I know this is supposed to be a mental health conversation, but I've got to talk about this. One of the reasons why copper is so detrimental in several of these areas is that copper is required to make blood vessels. Okay? Now, are there any people here, females, who have children? Thank you. All right, somebody finally said something. Yes. When you were growing that baby inside, you needed to make blood vessels. So quite naturally, your estrogen levels rose in order to support your pregnancy. But how does it support your pregnancy? One of the ways it supports your pregnancy is by increasing copper, because we use copper in order to make blood vessels. Now let's pause for a minute. What else requires blood vessels? Fibroid tumors, endometriosis. Indeed, the entire menstrual cycle is based upon growth and regrowth and ungrowth of blood vessels. So when a woman is estrogen sensitive and therefore copper toxic, it's actually part of a normal system. Here's the difference. These women have difficulty getting rid of the copper, okay? Whereas the normal or average female can get rid of the copper just as easy as it goes up, it comes down. But when it starts to rise, every time you finish a pregnancy, it doesn't go down. It stays there until the next pregnancy comes. When that next pregnancy comes, the copper levels rise even more. And that third pregnancy comes, woo, it rises even more. Anyone here in this room ever hear of these women who have killed their children? They're usually 3 or 4 kids, and then they kill their husbands, and then they may turn it on themselves. We hear these stories over and over and over again, and we think, my gosh, what kind of nut job was that? These were likely women who were extremely copper toxic, because what we see as a commonality is that they had multiple children. They're not usually just one child. These women were probably women who were estrogen dominant females who are copper toxic. Okay? And now I'm not making judgment. I'm not saying that the police department's out there, go check copper levels or go come talk to me. I'm not saying that. What I'm saying is that in the studies that we did, Dr. Walsh and the Walsh Research Institute, we found out that postpartum depression and postpartum psychosis, in 85% of the females that we evaluated, they were copper toxic. Well, that's half the equation. What about when you treated them? How did they do? Believe it or not, when they were treated, these women did extremely well. They normalized. They were not depressed anymore. They weren't psychotic. They had relationships with their children. Unfortunately, I know one woman who, she didn't come to us until after her 3rd or 4th child. She had a great relationship with her last child after that, but forever, her first 3 children could not stand her. Even when she normalized and she was trying to reach out, they wanted nothing to do with her. Okay. This is how copper at high levels can actually affect cognition. But in this case, I wanted to talk about some of the overlapping symptomatologies and disorders that are present because they're so prevalent in our lives. How many women, this just hurts me, how many women have had hysterectomies because they had huge fibroid tumors and some of them never had a chance to have a baby? But the entire uterus had to be removed, when really the problem was high copper. If we had known this 40, 50 years ago and acted on it, there'd probably be a lot more children around, a lot more grandchildren and great-grandchildren and so many other things, and who knows what contributions would have been made. Who knows what trouble might have been caused, but it goes both ways. But the idea of copper, and I'm glad you brought it up, is so huge. Behavior disorder in children. Boys, we talked about females. What about males and copper? A lot of our copper toxic males, remember, males do have some estrogen, some more than others, but nonetheless, copper toxic males, as little children, tend to manifest as behavior disorders. These are the unruly little kids who seem to be bouncing off the walls, and by the time they're in grammar school, the local police department's familiar with them. By the time they are in high school, usually they're waiting for a prison cell by the time they're 16 or 17 years of age. They start out as a behavior disorder child, they move into what we call a conduct disorder adult. And the whole deal here is that these are not bad people. They had bad chemistry. And yes, when these individuals are actually treated, their copper levels come down and they do very well. We had actually a very true story of a family of 4 young men from a well-to-do family. So you can take environment out of it. We had mom, we had dad, great suburban lifestyle, cognitively doing extremely well, Older brothers in med school, college, high school, all straight A's. Number 4, what we used to call the black sheep of the family. This kid was on his way to prison. Okay. Tested him, we found out that this boy was copper toxic. Treated him, he left the jail cell, and joined his brothers as a straight A student. These are true stories. This is about biochemical imbalances and how these things can actually affect cognition or behavior. So do we want to really get that boy on an almond milk diet? No. Okay. He has to now be aware of the foods that are rich in these elements. Now don't get me wrong. I'm not saying don't eat any of these things. What I'm saying is don't saturate yourself. Don't saturate your life. Don't saturate your refrigerator with these things. Okay. You are the masters. You're the ones who make the choices. Okay. Don't sit back and think, well, just because it's not this, that this is great for me. If you even suspect you have depression or anxiety, any of those other things, simple testing can alleviate any question for you. Okay. I'm the one who kind of just sits around and reads the labels and so forth, and I'll make my choices. I do. I'm going to have that pizza every now and then. I'm not going to lie. Okay. Every now and then I'll actually touch that vegetable and eat it. Okay. More often I know I'm probably gravitating more towards that steak, and I'm probably more like the type of guy who should be eating more dark green leafy vegetables. Okay. My mom would be proud. God rest her soul. But we have our beliefs, we have our pleasure-seeking taste capacities, and then we've got our cognition. So when most of us can get out of the funk very quickly, we don't pay too much attention to our diets. You know, I'll be that way for a few days, a few minutes, and that's it. But when the rest of us have troubles that go on for days, weeks, months, we make our parents miserable. We make our spouses miserable. When we ourselves are miserable, and we're so tired of ourselves that sometimes we actually want to end it all. Now we're talking about problems. So now we have to say, as we do here, we look at every single element that we can find that's problematic, not just from a biochemical perspective, but from an environmental perspective, and that includes diet. Anything that's adding on to our misery, we don't need. So one of the things we're very, very careful about, and we have to be. Gosh, there's one example I was going to give you. But anyway, any other questions at this point? Yes, ma'am. Oh. Woo! I can say a little bit, I can say a lot of it, but we got to say something about it. When you are this copper person, now, yes, I know this is supposed to be about diet, and you don't eat birth control pills, but you ingest them, so we can say we're okay to talk about it. They contain some level of estrogen or progesterone or a combination of the two. Anytime you've got an oral contraceptive on board, that exogenous estrogen is increasing copper levels, and it's a problem for those females who cannot get rid of the copper. Many females are not that person. They get along just fine. But I'll never forget the story that a young collegiate woman told me about, where she met this young boy freshman year of school, and they were just in love. It was that time, their first mated relationship, and she decided, well, you know, we wish to bond a little bit more, so I'm going to go on the oral contraceptive pill. And about a year later, they broke up. And he was quoted as saying, that girl got really weird on me. I don't know what I saw in her, but boy, I'm glad that relationship was over. Okay? And the interesting thing was, when she stopped taking the pill, she got better. Or I should say, different. Reported symptoms were anxiety, depression, erratic behavior, erratic thinking. Okay? So the very reason, and here's the sad irony, the very reason that two people got together and wanted to seal that bond more so, and somebody taking preventative measures, well, that ended up being the reason for their dissolution, their breakup, because it changed the cognitive capacity of that particular female. Not all females respond that way, but many do and don't know it. They'll tell you, ooh, boy, I know certain times of the month are far more erratic and far more difficult and far more this and far more that. Well, for them, copper sensitivity may be a real issue, and it certainly doesn't hurt to have yourself tested for it. In addition, Other issues may come up, such as the propensity for fibroid tumors, and later on, chronic copper exposure. By the way, copper is an inflammatory agent. It does create inflammation in the system, both brain and body. Now we know cumulative inflammation can be a predisposing factor for cancer. So being toxic with any inflammatory agent, not just copper, we have to worry about different cancers. But copper, remember, also feeds blood vessels, which when a cancer is growing, what do you think it's feeding off of? You. And how does it feed off of you? Well, it builds several umbilical cords between it, the tumor, and you, the human host. Those umbilical cords are made of blood vessels, and so those copper levels have to get high in order to support the blood vessels, in order to support the growth of the tumor. Okay. Anyone ever see any of those TV shows, the 500-pound or the 100-pound tumor in the 500-pound guy? Ever see that one? If you haven't, you're actually sitting there going, oh no, I've never seen that. Gotta see, it was interesting. And I figured, at one point I was watching, I said, gosh, so they're going to take this person to surgery, and they're going to take off this 100-pound tumor. Guy couldn't move. It was 100 pounds, no exaggeration. And I said, what's the problem? Just lop the thing off. And then they started to actually dissect. And they were showing the dissection on the program. And what did I see? I saw huge blood vessels, tons of them, throughout the tumor. And do you know what they said was the number one consideration or concern about removing that tumor? Leading to death. The vascularity of that tumor could cause this man to die because of all the blood vessels. Okay. Copper is extremely important in many situations when it comes to cancers and so forth and so forth. So I know I digressed a minute. We started off with oral contraception, but the idea of hormones, copper, and all the varieties of things that can happen, not just from a cognitive perspective, but a physical perspective, very, very important. Makes me cringe sometimes. Yes.
Yeah, can you talk a little bit about soy and tofu and those things? The replacements.
Yeah, the replacements, indeed. This is actually a conversation I had also with a family member, and this poor child was under methylated, and so I outlined. She said, well, can I have soy? I said, that's folic acid. She said, well, can I have satay? And I said, got folic acid. No, lutein got folic acid. She said, I can't eat anything. I said, you can eat whatever you want. You are a young person. The decision is yours. But these foods happen to be very rich in these folates, and that can affect your cognition if you are indeed.
Does it increase estrogen levels? That's what I heard somewhere.
Someone has said that. I'm not real sure, quite honestly, about the increase in estrogen. Although I have heard that about folic acid. But more so with reference to the methylation disorders and challenges, that's more so my concern. Okay? Because many of these individuals, by the way, are not necessarily high in absolute copper. Okay? So even if their estrogens are increased, their copper levels don't necessarily zoom up.
Is soy high in copper? Because I know beans are.
No, soy is high in folates.
Okay.
Soy is high in folates. There may be some copper, but you know what? Don't get me wrong. Many of these foods are high in many things. Mm-hmm. They may have zinc and copper, they balance each other, or they may have folate and methionine, which balance each other. It's not about the individual food alone. It's about the cumulative nature of your diet. How much of this stuff are you ingesting? That's what I'm referring to when I say be careful about diets rich in these particular elements. If you have a little bit of almond milk here or a little bit of a soy protein there, whatever. It's not going to make that much of a difference. But if this is where you're living, meals, snacks, throughout the entire day, 24 hours a day, throughout the week, throughout the month, throughout the year, this can be a problem. Okay? And that's what we're referring to. Unfortunately, many of the substitute foods that many people enjoy so well are unfortunately rich in folates. Okay. So you have to be careful. Yes, sir?
If you start treating high copper, how long does it take
That's a very good question. If you start treating high copper, it depends on how you treat the copper. There are several ways to go. There are often complexes of nutrients that you can use that will slowly bring down copper over months to literally a few years. There are specific elements like, first of all, people don't go out and buy this stuff, okay, when I tell you about it. It's the worst thing you can do, because if you bring out copper too quickly, your symptoms will get so bad so quickly, you'll drive your family members crazy, and they'll call me and scream at me, and I don't want that to happen, okay? But elements like molybdenum, M-O-L-Y, molybdenum, okay? I'll even write it for you. Don't blame me. You all go out and do this, and you turn into some creature that no one in your family wants to talk about. Molybdenum is actually a natural element in the human body, by the way. Many of these estrogen-dominant females, the estrogen-sensitive females, they actually don't have enough molybdenum to help bring down that copper. So molybdenum is a source that we often use to help bring down copper. Now, how much molybdenum? See, I'm not going to tell you that. Okay? But how much molybdenum dictates how quickly the copper comes out. I will tell you a little story, though. I've got so many stories. Once, total family member, not one of my families, but somebody we were treating, said, okay, here's how you take this stuff. I want you to take X amount per day in dropper form. Got a phone call 3 weeks later from the family members, angry. They said, she is a raging such and such, and we don't know what you did, but you are a charlatan, and we're going to come after you. I said, whoa, wait, Mr. So-and-so, what's going on here? Well, she's very moody, Dr. Mensah, and da-da-da-da-da-da, and she's irate, and da-da-da. I said, well, wait, what happened? Is she taking her supplement program? And he said, yeah, she takes it religiously every day. I said, well, now we talked about this thing, which will remain nameless from now on, but are you giving it to her? Yes, every day. She's taking, well, I'm going to translate now, 8 times the recommended dosage that you gave her. I said, I felt like Scotty from Star Trek. What are you talking about? You gotta be kidding me. She's gonna explode. I said, no. That's too high dosage. I said X, not 8 times X. Silence. I said, oh. I said, you know what? Stop for the next week. Let her come back down to normal. Give her 1 drop. This stuff is like TNT. It's that kind of powerful. It only takes a very small amount to do the job. And to answer your question, that can happen literally in a few months. Okay, we look on average for about a 6-month shift in copper levels. But it can be, and that's a good slow pace so that you don't have all the cognitive effects associated with copper toxicity. Copper is one of those strange metals. When it leaves your tissues and gets back into the bloodstream, every receptor site the copper hits lights up like it was fresh in the system to begin with. See, copper can be stored in your tissues. So when we're drawing out copper, and it moves back into the bloodstream on its way out. But on its way there, it's going to slap you, hit him, knock that one down, kick that over there, and do all these terrible things. But if you keep copper in the right concentration on the way out, you don't see those effects. So slowly is the key, but certainly. And there are other agents that can be used where you typically don't see those effects at all, and you get a very decent removal within 6 months. Any other questions at this point?
Nothing left for my son to eat.
There's always something, and we've got a great nutritionist right here with Gavin, who's our clinical nutritionist.
So why do you have vegan cookies with chocolate chips over there?
Why do I
Just
have?
kidding.
Okay,
Kidding.
I don't bring them. It doesn't mean we can't enjoy things. But we're not going to live. We're not going to live that way. Okay.
Just kidding.
Yes. Any other questions? Any comments? Any random musings or otherwise observations? Yes.
We were speaking about biochemical imbalances. I was just curious as to what the likelihood that is if the mother had some biochemical imbalances, what the chances of a child or children.
Awesome question. Awesome question. Could be rather high. Now remember, first of all, we have two parents. What's interesting to me is how sometimes entire families of biochemical imbalances get together and marry, and then they reproduce, and they have this person that could be a horror story. And when we do these genetic analyses and we go back in time, we say, my gosh, you have 5 generations on both sides of the family of pathology that goes back to biochemical imbalances. Methylation. Let's go back to that one for a minute. Well, we'll start with methyl. Methyl is heritable, by the way. Okay.
Is there a DNA test or something that you can...
About methylation?
Yeah.
There's a very simple chemical test, which is the histamine test that we use. Okay. There is now the MTHFR test that a lot of people are using, but many people really don't understand that too well, and they start getting into bad therapies. And even the practitioners still don't understand that quite as well as they think they do. So we're careful with that when we're still evaluating its veracity. But right now we're still using the histamine test to determine methylation statuses. But methylation is one thing that's very easily transferred from parent to child and on down the line. But remember, we talked about methylation and methyl with regard to what we call epigenetics. This is sort of the blueprint, but what's the environment doing to kind of shift that blueprint? Literally, in the womb between day 16 through 21. Okay? How many women knew they were pregnant? Day 16 to 21. None? You're a blessed woman. Most women certainly didn't. And if you don't, a lot of things are going on there in that environment of the womb that can affect your methylation. Okay? Elements like, let's say, some things are very controversial, so I won't mention them, but many things can happen that can change that methylation status. So you may have been born with a little bit of anxiety. Your child may be born and develop Asperger's or autism, or may be fine for the first 4 decades, start his own business and become an alcoholic. With undermethylators, we see trends towards things like easy susceptibility to alcoholism, chronic cigarette smoking, drug usage. Now, these are the folks who may try it even just once and they're just hooked. Now, don't quote me on this, and I don't want the overmethylators to test themselves just so they can see if they can use drugs or not. Okay? But the overmethylators tend to be able to sort of do whatever and then quit. And I'm not talking about the other ramifications. The body still deteriorates. But these are things that we see genetically, and we can see whole family histories. So-and-so's grandmother was depressed. Somebody else's sibling was bipolar. Somebody else is a schizophrenic. Somebody else is this. Somebody else is that. And then little benign things like an alcoholic or a cigarette smoker that was chronic. And what we're seeing is that these are all manifestations of undermethylation. So methyl disorders and methylation is indeed heritable. It is what we call an epigenetic phenomenon. As a matter of fact, nowadays what we're telling people is one possible reason why we're seeing such a rise in many of these disorders like ADHD, anxiety, depression, and autism is that, a lot of bright people are getting together and reproducing. So I'm not saying that overmethylators are stupid, far be it. But what I'm saying is that genetic shift, we're now moving into these colonies called suburbs. When we move into these lovely colonies, we go to these lovely schools where we find our soulmate, that wonderful intellectual, we just meet here. We think about everything the same way. Then we get married. Well, you know what's marrying quite often? Methylation is marrying. And they're producing little super methylators. And those super methylators are 3rd generation super methylators. Yes, indeed. I went to Northwestern. My wife is at Northwestern. We got married and we had another baby Northwesternite. Or indeed, I was a Harvard man. I met my Harvard wife and now we have our Harvard children. And, I forgot, Daddy was an alcoholic and Mommy was full of anxiety. But nonetheless, it's irrelevant. The idea is that because we're able to now group, as opposed to in the old days where lovely guy meets lovely woman in the same town, and you may be what you may be, and he may be what they may be, and it's much more diluted as far as methyl is concerned. So we get married and we have normal people. And maybe those people will move to another town and marry other normal people. Well, now we're deciding we're going to marry the super brainiacs or the super creative people or super whatever, and we're getting double doses of this stuff on both sides of the methylation issue. In some cases, it's kind of interesting when I literally was talking on the telephone during a consultation to a woman who called me and I said, well, what's your challenge, ma'am? Why did you want to do this consultation? And she said, well, it wasn't me, it was my significant other, he tests these over methylator. And so I'm like, well, you're testing as an over methylator. And I go, that could be really interesting because you people tend to be more balanced. Now, a lot of the symptomatologies present could be kind of difficult because over methylators are often procrastinators and under methylators are usually the go get 'em driven type, let's get it done yesterday. I like the analogy of the wife who says, all right, let's get this done, and the husband whose butt is surgically implanted on the couch. Okay. These are not exactly exact analogies, but you get the idea. But it's becoming one of those things where we're starting to say now, you know what? Because of the high incidence that we're seeing of certain disorders in children, maybe you and your future spouse might want to get your methylation statuses checked. Now, I'm not going to be sued for any divorces that happen or for people who decide not to marry. What I'm suggesting is have information ready for yourselves. We can actually find out if you're undermethylated and she's undermethylated. We can say, you know what, you may have a higher chance of having a child with certain predispositions. So if you see your child developing or not developing in certain ways, act on it immediately. Okay? Many of those things can be treated. Many of those things can be corrected, and it means watch out for future disturbances. It doesn't mean that Jimmy and Anna or whomever can't get together and still have wonderful family lives, even though they're both undermethylators. Bless you in your perfectionistic challenges and how you're possibly going to survive each other. But wonderful, go ahead and do it. We're just saying, have information. Yes, indeed, many of these things are heritable. So is high copper, by the way. The predisposition to not getting rid of copper very easily can run amok through families. I have seen, literally, 2 daughters and a mother walk into an office, they all got tested. They came in because of one child. Okay? Their copper levels were almost 3 times higher on the scale than normal. That is excessive. When we say copper is 110, the one child was 285. That is more like logarithmic scale. So every unit of 1 is like 10. Okay. The mother was 245. Her sister was 255. I said, oh my gosh. I said, look at this. So this is running rampant, which means what? That daughter you think is a loon, who doesn't listen to anything you had to say, but then she reminds you of you, so you can't stand her because that's how you acted with your mother. Okay. She is somebody who it's not her fault, it's more likely your fault. But it's not your fault, it's more likely your ancestor's fault, going way back to great caveman ancestor Ugg. Okay? So a lot of things are heritable. A lot of biochemical imbalances are heritable, and a lot of tendencies are heritable. Which is why it's always not a bad idea sometimes just to get yourself tested. Okay? If there's any curiosity, any concern, you might want to go there. Knowledge is power. And that's the end of our session for tonight.